Hello and welcome to another episode of For Your Health. I'm Mark Crosby of Quincy Access Television. So glad that you joined me and my guest in studio today, Christine Kosha. She is a tobacco treatment specialist for the city of Quincy. Welcome back, Christine.
Thank you for having me back, Mark.
Great to have you. You and I have done multiple programs together on the topic of smoking. Today, we thought we would talk about, kind of dedicate the show toward ways to quit.
Yes. I thought it was important to cover the topic of nicotine replacement therapy and just other ways that people can go about quitting smoking. I like to tell people that when you try something to try and quit smoking and it doesn't work for you, there is always something else that you can try. Years ago, people were very limited with the options that they had when they were trying to quit. If you either went cold turkey or you used a nicotine patch, that was pretty much it. But today we have a lot of different other options out there. So I thought it would be nice to go over everything and just make people familiar with the options that are out there as far as quitting smoking.
So I suppose where to begin?
I think we maybe just talk a little bit about each one. The first one that pops into my head is the patch. Of course, the nicotine patch, again, is one of the first forms of nicotine replacement therapy. It's been around for a very, very long time. The success rate with the nicotine patch is very high. As long as people use it the way it's intended to be used, they definitely have a greater chance of quitting successfully. The thing I like to go over with the patch is a lot of people don't know where to begin when they're using the nicotine patch. You could easily walk into a pharmacy and pick up a box of patches, but if you don't know which patch you need, sometimes you may end up with a patch that's either too strong for you or not strong enough. So that's why it's important to kind of go over if you're going to go in and pick them up on your own, read the box and make sure that you know what you're getting. The patch itself comes in 3 different strengths. There's 21 milligram, 14 milligram, and 7 milligram. The 21 milligram patch is for anybody who smokes at least a pack a day. So that's where people who are on a pack or more would start. 14 milligram patch, probably about 10 to 15 cigarettes a day. And then the lowest patch, the 7 milligram, would be maybe somewhere between 3 to 5 cigarettes. So if you're somebody starting out with the 21 milligram patch, you would want to do at least 2 weeks with the 21 and then gradually decrease down to the 14, do the same thing at 2 weeks, and then end the last 2 weeks just of your quitting process with the 7 milligram patch. And the idea, of course, is that you're getting used to having less and less amounts of nicotine in your system with each patch that you drop down to. The other thing I like to tell people, over the years I have found that people who are very heavy smokers, they sometimes find that being on each patch for 2 weeks isn't long enough. So I think that it's really not a problem at all for anybody to stay a little bit longer on the patch if they need to. The only thing you're getting from the patch is nicotine versus all of the other chemicals and additives that you would be getting in the cigarettes. So by extending the time that you're on the patch, there's really never been a big issue with that. As long as you know that your goal is eventually going to be off the patch, staying on the 21 for a little bit longer and then decreasing to the 14 a little longer and so on, I don't see any issue with that at all. But it is important for people to know what strength they need when they're starting out.
The importance of being able to really almost talk one-on-one with someone when you're going through the quitting process.
Yes, absolutely. No matter what, and I really should start out by saying this, no matter what method you choose when you're trying to quit smoking, having some sort of support system in place makes your chances of quitting successfully that much higher. So having somebody to meet with on a counseling basis week to week or every other week or whatever it works for most people when they're trying to quit is very important when people are trying to stop. So using any kind of form of nicotine replacement therapy, having somebody to speak to about it from week to week, making sure things are going well, that you're not having any issues with it, that sort of thing, it really does make a big difference.
And I know here in Massachusetts, there is a hotline.
Yes, we have the Massachusetts Smokers Quit Line. Most states offer some sort of smokers quit line. We have the quit line here in Massachusetts. It's 1-800-QUIT-NOW is the number. And they do offer telephone counseling for people who are interested in quitting that way. If you speak with somebody over the phone for telephone counseling, if you live in the state, you are also eligible for nicotine replacement to be sent to you. So you can get a certain number of counseling sessions over the phone, and then they send you the nicotine replacement therapy. So Again, you have somebody that you can speak to via telephone and just to check in with week to week or however you want to schedule your counseling sessions, and they can kind of offer you the support that you need. And again, any way that you're getting the support is going to be more, it's going to make you more successful when you're trying to stop.
Find your reason. Why are you choosing not to smoke?
Reasons for wanting to quit are different. We certainly could sit here and come up with reasons why people shouldn't smoke. We could sit here all day and come up with those. But and often I have had people do that, and then I have asked them to come up with a reason or a list of reasons why they should continue to smoke. And of course, those lists are always very short, other than some people feeling like they still enjoy it, that sort of thing. But the main thing that you need to come up with is your reason for wanting to do it. What is your motivator to want to quit? For some people, it could be their family, their children, maybe their husbands or their wives are really encouraging them to want to quit. It could be just financially, the amount of cigarettes we know, and I've always told people, the one thing you can count on as a smoker is the cost of cigarettes is always going to increase. It will always increase. I don't think, when you talk about the costs right now, a lot of people are just so shocked at what we're looking at for a package of cigarettes right now. I was looking at a list just a few weeks ago of the cost of cigarettes by state, and Massachusetts is number 3. New York is at number 1, but we are at number 3, so it is really very expensive to be a smoker today. So of course, cost is another big factor for people, and of course, health. Those things are always at the top of the list.
So the patch was what my father-in-law used to get off cigarettes, and his reasoning was for my child, so for his grandchild, he didn't want to be smoking around him. That's a
Right.
good reason, and the patch was a good way to quit.
Absolutely. That is a great reason. As I say, we sit here and we talk about reasons why you should quit, and there are always great ones. But I think that what you need to have as number one all the time is yourself. You need to be there because you want to quit smoking. Having family members or financially being burdened by the cost of cigarettes, all of that are very, very important. But you really need to make yourself number one as far as reasons to quit.
And interestingly, as I was researching, I came across a point that said, reward yourself.
Yes.
Important, I think, whether you make that a vacation and kind of give that to yourself as a reward, or some other gift to yourself.
I couldn't think of a better reason to reward yourself than when you're successful at quitting smoking. It's not an easy thing to do, and when people are successful at stopping or even cutting back significantly, I couldn't think of a better reason to give yourself something that you've been maybe wanting or thinking about getting for a while. Years ago, we used to encourage people to take the money that they would have spent on cigarettes and put it somewhere, maybe in a glass jar every day. It doesn't necessarily have to be the entire amount, but maybe $5 or whatever you can afford, put it in the jar every day. And at the end of even a couple of weeks, it's amazing how much money that you have. It really accumulates quickly. And at the end of maybe the first month, it'd be the greatest time to get yourself something that you've been wanting, and I couldn't think of a better reason to do it.
Quitting cold turkey. So my father-in-law took the patch. My father quit cold turkey after smoking since he was 16. So it can be done. It's difficult, but I guess if you set that goal for yourself, then it's attainable.
Absolutely. Cold turkey is, there are a lot of benefits to quitting cold turkey. The biggest benefit to quitting that way is, as far as getting the nicotine out of your system, it's out of there between 24 to 48 hours. The negative to quitting cold turkey would be the withdrawal symptoms. You don't have anything else to fall back on, so those withdrawal symptoms hit you pretty quickly. And so you're going to be hit with one or two, or maybe everything under the sun. But once you do get through those withdrawal symptoms and everything is out of your system, then yeah, you've finished with that. Nicotine replacement therapy does make the withdrawal symptoms a little bit easier, because you do have the patch and the gum and things like that to fall back on. But yes, cold turkey, it works very well if you're willing to just sort of suffer through everything in the beginning and get it over with. But some people find that's the best way they do it. They prefer to do it on their own, and they just want to, get it over with and pick a day and be done with it. It's really different for everyone.
You mentioned patches, you mentioned gum, pills.
Yes, there are 2 prescription medications available for people who quit smoking. The one that's been around the longest is a Wellbutrin, which was originally an antidepressant medication. So what they were finding over the years was people who were using Wellbutrin as an antidepressant medication that were smokers, they were suddenly finding that they didn't have as much of a desire to smoke, and they were quitting. So they took the medication, they sort of changed the milligrams to it and put it out as a stop smoking medication, originally under the name Zyban. So people were getting the prescription, and the thinking was you were able to use the medication Wellbutrin along with using the nicotine replacement therapy, like the patch. The thinking was the patch and the gum and the mints helping with the physical craving, and the Zyban helping with the mental craving. So it was just sort of taking the edge off of the desire to want to smoke. So the 2 used in combination were very successful. A lot of people had great luck doing it that way. The other medication that has been available is this Varenicline. It is under the brand name Chantix, which people are probably familiar with. Chantix has been around for a good while now, not as long as the Wellbutrin, but it has been out for quite a while. There have been a number of people that have used Chantix and had success with it. The difference with the Chantix and the Wellbutrin is you don't use nicotine replacement therapy with Chantix the way you would with the Wellbutrin. And from what I've heard from people over the years, some of the side effects with Chantix can be a little bit more difficult. But again, it really depends on the person. But it really, I just really think no matter what method you choose, if your determination to want to quit is strong enough, anything that you use is going to help you and you'll be successful.
Nasal sprays, those are often used as well.
They are. There is, again, I don't know that many people are aware, but one of the other options as far as prescription medications is a nicotine nasal spray. You can talk to your doctor about it. The most popular brand is Nicotrol. And the nasal spray comes in 1.0 milligrams of nicotine. The benefit to the nasal spray is it delivers the nicotine faster into your system. A lot of people don't really like the idea of using a nasal spray, but it does deliver nicotine very quickly, and it is something that's available. It's been available for quite a while, but again, I just wanted to cover every option that people are aware.
And inhalers, that's another option.
Exactly. Another Nicotrol product is a nicotine inhaler that's available. This is something, again, that you would talk to your doctor about. It's a little plastic, it almost looks like a plastic cigarette. It breaks apart, and the prescription that you would get would be for nicotine cartridges that go inside, and then you would just sort of puff on that throughout the day, and you would use the inhaler as often as you need to. So those are 2 other options that you can speak to your doctor about that have been available to help people quit smoking, in addition to the nicotine patch and the gum and the nicotine lozenges.
Alternative therapies like acupuncture.
Yes. In addition to nicotine replacement therapy, there are things that other people have tried that have had success with. Hypnosis is one. Acupuncture, as you mentioned, is another. So there are other things out there. I would say things like hypnosis are recognized as more of a relaxation tool, something that you can use instead of, in addition to, I should say, the nicotine replacement therapy or the medications. Sometimes with hypnosis therapy, the goal is for people to just sort of get positive messages in their subconscious mind about not wanting to smoke. And the hope is that when you're finished with the hypnosis, that will stay with you. So the next time you're having a craving, you're going to remember all of those things that were said, and you'll be able to get through the craving a little bit easier.
Give yourself a break is one of the tips. One reason people smoke is that the nicotine helps them to relax.
Yes. It's interesting with that. What a lot of people don't realize is they do tend to think that when they're having a stressful day or bad day, that having a cigarette is going to help to calm them down and de-stress them. What's actually happening there is the deep breathing that you're doing is what's calming you down. So people don't always think of it, but when you're breathing in and out, when you're smoking that cigarette, each drag that you take is sort of calming you down because you're breathing in and out. So you can accomplish the same goal with just some nice, clean, healthy, deep breaths, taking in nice, clean air, doing maybe 3 to 4, holding each one as long as you can and letting them out. A lot of times people who try that actually do feel as if they went out and smoked a cigarette because you're doing the same thing, but you're bringing in nice, clean air as opposed to all of the other junk that you're getting from the cigarette.
But that's fascinating. So it's the inhale and exhale that is part of cigarette smoking that is actually the calming aspect.
Exactly. And again, I think a lot of people connect the two, but that really is the calming factor with the whole process of smoking. It's not the cigarette itself or the nicotine or anything that's in it. Nicotine being a stimulant, it increases your heart rate and sort of gets you a little bit more pumped up. So it's not always the calming factor. It's more the breathing in and out.
Let's talk about triggers. Oftentimes, if someone's smoking, the other hand has a drink,
Yes.
alcohol.
Right. There's a variety of triggers. They're, again, something that's different for everybody. But the main ones, the ones that are most common, would be alcohol. People who drink, they usually tend to smoke, and they usually tend to smoke more than they normally would. Things like coffee. Coffee is a big trigger for a lot of people. Caffeine. Food, or just eating meals after dinner, after lunch. It's a big time for people to smoke. The car can be a trigger for people. A lot of people who smoke in their cars as soon as they get in there.
Yeah, my dad, as a matter of fact, would run out and do all the errands that needed to get done because during that time in the car, that's when he was smoking.
Exactly. A lot of people look at the car as their time. You have a lot of people who smoke to and from work. They have a certain routine that they follow. They know they can get 1 or 2 cigarettes in before they get to work, and then they can do the same coming home. So the car is definitely a big one. Other people can be triggers. You may see people that you're used to seeing every day, maybe at work or at school or whatever it is, and as soon as you see them smoking, it triggers you to want to smoke. So
kind of the social aspect.
Exactly. So triggers are different for everyone, but getting familiar with those is important when you're coming up with, I think we talked about so many times before, coming up with your quit plan. And your quit plan including, how am I going to quit, and when am I going to quit, and what do I want to use to help me quit? All of those things.
So what does a quit plan look like? I'm sure it is different for everybody, but I mean, is giving yourself a couple of weeks a good idea? Is giving yourself a couple of months a good idea?
I think it really depends, again, on the person. It's so hard to compare two smokers when they're trying to quit because everyone is so very different. I think you really need to look at your whole habit of smoking and you need to decide what's best for you. And I think starting out with how you want to do it. If you want to use some sort of nicotine replacement therapy, do I want to use the patch? Do I want to use the gum, the mints? Do I want to look into prescription medication? So that would be the first step. The other thing that I like to really put out there too, as far as methods for quitting, is cutting back. I work with a lot of people right now who just don't feel comfortable picking an actual quit day and stopping. So we talk a lot about cutting back on smoking, which is another great way to get yourself off of cigarettes. If you look at your habit of smoking, if you're somebody who's smoking a pack a day, and you just say to yourself, okay, for the next week, I'm going to try and eliminate just 1 cigarette. And not even for the week, but maybe for 2 days, say, 24, 48 hours, I'm going to eliminate just 1. I wouldn't usually recommend to people they don't go for one that they truly, truly need, like that first one in the morning and after dinner and things like that. But I would go for one of the ones in between that they know that are probably just pure habit type cigarettes. Try and eliminate one of those. And if that goes well for 2 days or so, try and eliminate a second one. And then just kind of gradually cut back that way. It's a great way to do it. Every cigarette that you're eliminating is that much less of the junk and the additives that are getting into your system. And it really is a fantastic way to go about quitting if you don't want to pick an actual day to stop. You just want to make sure that your ultimate goal is 0. And that's different for everybody. You might say, I want to be at 0 by the end of this year, and maybe by January 1st. I'm going to give myself 6 months or 3 months or whatever it happens to be. But you want to make sure that your ultimate goal is to be completely smoke-free.
So when the urge hits, one of the things that you can do, and I kind of laugh at this, but you could have a very clean house because you can clean house, right? You can do an activity that takes your mind off of smoking, because what I thought was fascinating, one of our other shows, you talked about how quickly the urge disappears.
Absolutely. A craving to smoke a cigarette usually lasts no longer than 10 minutes. So if you tell yourself that going into it, and you say to yourself, well, I know this craving is going to pass, let me just keep myself busy with whatever I can. whatever that is. And even if you need to break it down to every couple of minutes, every 2 minutes, 2 minutes, 2 minutes. I'm keeping busy with cleaning a house is a fantastic one. Going through the mail, reading a magazine, reading a book, maybe looking at your phone, responding to emails that you maybe need to do or text. That's going to keep your mind off of the craving when it sets in.
Go for a walk.
Exactly. Going for a walk is one of the best ones.
Benefits that you can gather from a walk is fantastic, but you don't have to do more than 10 minutes a day to see the benefits.
Exactly.
So there are the 10 minutes that you could be dealing with the craving.
Exactly right. You know, I recommend walking to everyone. It's usually in those weeks following quitting when people are starting to feel better, their energy levels are improving, and their lungs are cleaning out, and they feel like they can breathe much better than they ever did before, that sort of thing. They feel motivated to do something, again, looking at it as replacing something negative with something positive. So I always recommend walking to people. It's something you can do on your own. You can fit it in at any time. You don't have to pay for it. You can walk anywhere you want to. Pick a place that you love and just start a program a couple of days a week and then increase to maybe 3 days a week. And like you say, you can start out with 10 minutes and then gradually increase that if you want. Stick your earbuds in and go. You know, you have time to yourself and you can just get out there, you're getting exercise, and it's definitely helping you to get away from the craving.
Another important point is try and try again. Don't
Yes.
get discouraged.
Absolutely. Most people have several quit attempts before they finally get it right. And the interesting thing when you're talking to people trying to quit, when they look back at their quit attempts, usually they find that they've made a little bit further each time, every time that they try to quit, even if it's just by a day or even if it's just by a few hours. But most people find that they do tend to get a little bit further both times. And that, I just try to get people to look at those as practice attempts. You know, you've had practice attempts in the past, and this is just kind of getting you to the place where you're going to do it for good.
At one point, we talked about oral fixation. So instead of putting the cigarette in your mouth, fruits and vegetables.
Absolutely.
Chew on those.
Absolutely. All great ideas. Carrot stick, celery stick, a straw, a pen, a pencil, anything like that. The hand-to-mouth part of smoking is big for a lot of people. That's one of the things that they tend to miss. So you can fill that in very easily with any one of those things. If you just carry a pen or a pencil with you, a carrot or a celery stick is great because then you can eat it. You know, if you're holding
Right.
it, then you can eat it. It's healthy food. So there are definitely ways to address that particular part of the whole habit of smoking.
Time is on your side.
Yes, absolutely. There is no set time limit to quitting smoking. And again, going back to the cutting back piece, people sometimes get concerned that they're not quitting fast enough, or maybe they should be working at it. You know, they may not be 100% ready to completely stop. But there is no time limit to it, and I think people need to just go with what makes sense for them. If you're not somebody who wants to just pick a day and quit completely, just chip away at it. You know, just pick those cigarettes that you know that you can do without during the day, and just eliminate those as much as you can. And then just make yourself a long-term goal, and just again, as we talked about, just maybe 6 months or a year, or even just say I'm going to take this as slowly as I can.
Talk about the physical, I suppose, the physical aspects of a smoker's face.
Yes, absolutely. You do notice with people over time the differences. If you have somebody, maybe you have two people that are the same age, someone who's never smoked at all and somebody who's been a lifelong smoker, you can definitely see that. It affects your skin. Wrinkles develop, you know, over your upper lip, like maybe like just certain parts of your face, and you just some heavy smokers can develop almost a gray look to them, you know, that sort of thing. It's just discoloring of the skin. So there is a big difference. And the nice thing about quitting is all of those things improve, and that does include your skin. So when you're drinking water, which is a great suggestion when anybody quits smoking, it helps to flush things out of your system faster. But it's also great for other things. It's great for your skin. It's great to fill you up so you're not eating more, that sort of thing. So
the tautness of the skin can be affected.
every cigarette is different as far as the additives and what they put in, but it affects people. And if you are somebody who's been smoking a pack a day or more for most of your life, then that is going to show up in, you know, just the way that you look.
Clearly, smokers' teeth.
Yes, absolutely. It's
Noticeable.
another thing. The tar and the nicotine, they all really do a lot of damage to your teeth. Your gums can be affected. There's always that chance of mouth cancer, tongue cancer, lip cancer, that sort of thing. So there's always that, dentists are always, I think shocked when they see people come in and they know there's patients that smoke. It's very easy to tell. And over time, even if you don't have a lot of damage, if you continue to smoke, that certainly is going to be something that will happen.
And where you're holding the cigarette, stained skin.
Yes, absolutely. The nicotine and the tar and all of those things, when you're holding them, people do discover that their fingers start to become yellow, and yeah, you get a lot of that.
Hair loss
Yes.
can be attributed to smoking.
That can be another thing that happens when you're a heavy-duty smoker. And again, it really is depending on the cigarette brands that you smoke and the additives that are in there and how they affect you.
Cataracts for the eyes.
Yes, yep, absolutely. There are a lot of people who are who've been lifelong smokers that will sometimes find when they're driving at night, they have difficulty seeing, and that could be due to cataracts forming from their smoking. The other thing is, if you are somebody who smokes in your car, the way that cigarettes create a film on the windows and walls, if you're smoking inside your house, that can also happen to your eyes. So there could be a little bit of a film there from smoking inside the car, and that can affect your vision.
And you had mentioned the skin. Psoriasis is a skin condition that can be attributed to smoking.
Absolutely. Yeah, it's really very little from head to toe that isn't affected when you're a smoker. But I always try to stress to people that the great thing about it is when you quit, all of these things do improve themselves. So you will see a marked difference in the way that you look, in your skin tone. Everything changes when you're not smoking anymore. So it's not just inside, but outside as well.
And reproductive problems.
Exactly. Yep, that can cause issues in that way for women who are trying to get pregnant, that sort of thing. If you're a smoker, it can make it a little bit more difficult. So yeah, that's another thing to consider.
So many reasons to stop, and
Lots.
certainly to never start is if you can avoid it altogether. Absolutely. In the last few minutes, anything that we haven't touched upon that would be another way to quit?
I think some of the other, just quickly, the other products that are available as far as quitting. So we've talked about the patch. The other nicotine replacement products that are available would be the nicotine gum and the nicotine lozenges. They don't contain that much. They have very small amounts of nicotine, either 2 milligram or 4 milligram. But the nicotine gum and the nicotine lozenges work very well with the nicotine patch. So if you're somebody using the patch and you're doing well with it, and you find that you're going along and it's doing what it's supposed to do and you're having luck, but every once in a while you might have a craving that's a little bit tougher, that's when something like the nicotine gum or the nicotine mints come in very handy. It's only a little bit more of nicotine, but it kind of help to get you over that difficult period that you're going through. And then they have the other things that are available by prescription that aren't as popular, but they're still available, nicotine nasal spray and the nicotine inhaler. So those are two things that people certainly can talk to their doctors about if they're interested. But again, there are a number of things out there to help people quit smoking today.
One of the other things, and I know we just have a minute left or possibly less, but we talked about pregnancy. Early menopause is attributed to smoking.
Exactly. That's another thing that can happen for lifelong smokers. They find that menopause occurs quickly or faster than it normally would if they weren't smoking. So,
and of course, the smell of cigarettes is never appealing to anyone, even the smoker sometimes.
That's right. Yeah, absolutely. I think if you find people who quit, if they were people that smoked at home, a lot of times one of the first things they notice is just the smell just remaining in the house, opening the closet, taking out clothes, finding the smell remains on your clothes, on your coats, things like that. It's always a great idea once you've quit to maybe like repaint or just do a nice clean in the entire house, or maybe take some of your clothes that have that smell to them to the dry cleaners, get everything clean. Same thing with the car. Maybe detail the inside of the car, get that smell out of there, make everything fresh and new.
Very good. Well, a lot of information on this program.
It
Thank you
is.
so much for stopping by.
Sure. Yeah.
And thank you at home for watching. And please remember to support the local access station in the community in which you reside. Stay healthy.